frustrated, like you've exhausted every single treatment option for your pelvic and bladder pain, I have a treat for you today. In today's live, we'll be discussing how an osteopath can be part of your pelvic health journey and a part of your team. And before I get started, please make sure to like and subscribe to get more pelvic health tips. Also, if you would like a free copy of my pelvic and bladder pain guide, please look in the description box below and grab your copy today. And in case you are new here, my name is Alison Coombs, and I empower women to adopt a holistic, balanced lifestyle so that they can improve and or eliminate their pelvic and bladder symptoms and reclaim their lives. I do this through my self-study, group, and private Coombs Method coaching programs. Again, in this video, you will learn about how Osteopath can be a part of your pelvic and bladder pain journey. Let's get started. We are live, so I just wanted to say welcome to anybody that's watching live or people that are watching the replay as well. My name is Alison Coombs, and I'm the founder of this group. It used to be called Moms with IC, but recently we changed the name to incorporate and support more people. So now it's Interstitial Cystitis, Pelvic Pain, and Pelvic Health Support Group for Women. A long-winded name. We might have to try to call it something different, but for now, that is what it's going to be because it's easy to find and self-explanatory. We've had a lot of new members come in, so these little lives that I do is just to bring some more awareness to pelvic pain and IC. So I often will have professionals jump on and we'll just have a nice conversation about their particular area of expertise, and we just share that knowledge with you. All right, so thank you and welcome. Today we have lovely Sarah Pakal here, and she is a wonderful osteopath. When I lived in the Scarborough Bluffs area, she was my osteopath there, so I thought it would be nice to bring her on to chat with you guys about this particular discipline and how this can help if you have pelvic or bladder pain, how this could possibly help you. So welcome, Sarah, and thank you so much for coming on and giving us your time today.
Thank you, Alison, for having me. I'm looking forward to it.
Thank you. So we're going to jump right in. I wanted to know, for people that are watching that may not be familiar, what is an osteopath?
Yeah, of course. So an osteopath, in Canada, we are manual osteopathy or osteopathic manual practitioners, just because the word osteopath is actually significant of a doctor of osteopathy, which you have to go to the States to become. So in Canada, we use our hands only for hands-on treatment approach and really looking at the body mechanics. So how well is your body moving, considering every aspect of the body. So working through the layers of the fascia, tissue, muscles, ligaments, bones, joints, of course, and then also considering the fluid dynamics. So how well is your circulation moving? What about the lymphatic system? Are you getting proper nerve control and proper nerve function throughout the body? So really considering the entire body as a whole, not as separate parts, and how everything is working together from an anatomical level. And then that, of course, will affect your physiology or the cellular level.
Okay, awesome. All right, so from what you have seen in your own personal practice and research, etc., what do you believe that some of the root causes of IC could be, and or pelvic pain? You can talk about them individually or the same, depending on how you want to answer the question today.
Sure. I'll talk about it as the pelvis as a whole. Just because there is one thing in osteopathy is that it depends quite a bit because, as you know, every body is different. We all might have a label of the same symptoms or perhaps disease or anything under that umbrella, but it all might present a little bit differently, especially when you come into my office. I'm going to take a look at how does your body move. So when we consider the pelvis, we want to consider how you're actually loading into the pelvis. So from the feet up, and then as well how the head down is loading. So kind of imagine every time you walk, right? If your ankle, for example, isn't moving very well, that's going to create a chain reaction up into the hip, up into your pelvis. And all of a sudden, you don't have proper gait function through the SI joints. Over time, that's going to create a chronic condition and you're going to start to get tissue changes. So it's a very very complicated. There's so many different avenues we could take this, but I do believe how what's loaded into the pelvis has a big impact on how the pelvis is going to function. And then, of course, on the individual joints and mechanics of the pelvis. So I'm sure your group is pretty familiar with the sacrum.
Yeah.
Yeah, the sacrum and SI joints. Okay, perfect. So that sacrum has to move in the pelvis. It nutates and counter-nutates or flex and extends. With the spine and the SI joints open and close, they also rotate forwards and back. So there's a lot of movement capability you want to see in the pelvis. And anytime, for example, that sacrum gets caught, we call that a rotation, but it can sometimes twist just like you would twist your body. And all of a sudden those SI joints don't move properly. So now you've changed the fluid pathway from a circulation perspective, from a drainage perspective, even from a nerve control perspective. So when it comes to anyone coming in with pelvic pain, the big thing is we need to look at your global pattern. So how are you loading into the pelvis? How can we take off any extra tension that shouldn't be there? Because we also want to figure out, is it the pelvis itself, or is the pelvis potentially a sidekick to a bigger issue happening? And that's just where the stress of the body mechanics is loading.
Awesome. That is a great way to look at it. Yeah, it's a great holistic way to look at the pelvis, because there's nothing, the bladder's not in isolation, the pelvis is not in isolation, right? They're parts of the whole body. So I love that. I love that approach. So in regards to pain, does an osteopath look at like the presentation of pain in the same way? So if someone was having bladder pain or pelvic pain, do they look at it kind of in the same whole body sort of way, or?
Yes. Yeah, definitely. So big thing with pain, my mind always goes right away to inflammation. So where's the inflammation response coming from? So is it coming, again, the sacrum, because it's part of all the nerves for the pelvis come from the sacrum. So we want to really pay attention to how is that moving? Does it have proper mechanics? Regarding pain, it's yes, we'll look at the sacrum. How is it moving? If the tissues feel quite inflamed, quite boggy, we also want to ask, how is the fluid moving? So then we move into a little bit more of how do your bowels move? Do you have good elimination through the body? How is your digestion? Do your tissues actually get good, healthy blood to them? So the body's processing nutrients, providing the blood with healthy blood cells that supply the nerves that then help eliminate the pain. So yes, definitely taking a look at the overall mechanics. And then there's always going to be an impact in the brain. And although we can't treat the brain directly, of course, because it's protected in the skull, but we can treat the cranial bones or the bones of the head to affect the different areas of the brain and to make sure that, again, we have good movement through the head and there is good, I'm sure everyone has heard of the vagus nerve. And if you haven't, it's a really important nerve that helps the parasympathetic or the rest and digest system of the body. So I'm often looking at where that nerve comes out through the back of the head and how is the head moving? Because if your head isn't moving, that nerve is possibly being pinched or irritated, and that's going to create a whole chain of events down the body. And pain is subjective, right? So, especially as women, I feel like we do hold stress and tension and very sensitive pelvises, I would say. So for a man, you could come in with the same body, but maybe a man feels it as headaches and a woman feels it as pelvic pain, right? So pain is interesting because you never want to chase the pain.
It's interesting you talk about a headache in the pelvis. There's a book with that actual title,
Oh, get out. I didn't know that.
Yeah, it's a great read. I'm always reading books, so I'm sure I can find a book for everything you talk about. I'm like, I read a book that had that title.
Okay, and was it about the vagus nerve?
No, it was just I read so many books recently. I don't know I
Okay,
can't
that's
remember
okay.
exactly what that one was about, but it was just I think it was about like using relaxation and progressive relaxation techniques to affect the pelvis. That was one of the ways, and using internal manual therapy. I believe that was the one that was about that. It was they're a good book. That one was a good book. I remember it on my good book list.
Nice.
um so thank you for that. That is very helpful. The vagus nerve, there's a lot of chatter about that recently, like on social media, and through different practitioners as well. And I know there's different ways. I know like if you sing, then you can affect the vagus nerve, like, and words like low humming, like those sorts of low humming. And I think it's a great way to tap into the parasympathetic nervous system. Um, so it does so I guess like the osteopath kind of practice, does that help the body to return to parasympathetic nervous system? Is that mostly the main goal of it, to restore balance in the body as well?
Yes, to restore balance, exactly. So it's interesting because the nervous system, if the sympathetic or the fight or flight response rises, the parasympathetic will have to come up too. So you end up in this really heightened, dysregulated nervous state. So as we bring the sympathetic down, the parasympathetic will come down with it. So they always want to be in balance.
Mm-hmm.
Um, yeah, so it's again looking at the whole body, and oftentimes it's interesting with pelvic pain, especially. There's a lot of connection to the jaw. Yeah, so in my practice, I do treat, and especially depending, if someone comes in with very severe pelvic pain, sometimes you can't touch the pelvis, right? It's a no-go zone. It's too painful, too sensitive. Of course, if there's any trauma as well, right? It's kind of a please don't go there. So we
Mm-hmm.
can't even assess the sacrum to see what's happening. So right away, I treat the jaw, treat the cranium, release the vagus nerve, because in the jaw we have the trigeminal nerve, and actually part of our nervous system response to soothe itself is to clench. So as we might kind of be walking around with clenched pelvic floor and
Mm-hmm.
not able to relax that pelvic floor, a lot of that clenching is also seen in the jaw.
Yeah, I often teach my clients the same of like
Okay.
when we're doing like diaphragmatic breathing, I'm always
Mhm.
reminding them, or if we're doing yoga, I'm always reminding them, hey, like, as you're doing your breath work, you need to be mindful of releasing your jaw, right? Because if you're holding tension in your jaw, it can mean tension in your pelvic bowl, and we don't want that tension. So, it's so interesting how something that can seem so unrelated as the jaw, right? Look how far away they are, but it's related, right? It's
Yes.
on the vagus nerve. I was looking at a diagram and how far down the body, like all the way from up to, it was so fascinating to me, like how it ran as well, and how that something that you may not think about can affect so much of
Yeah.
your quality of life, right?
Yes, definitely.
So someone that's coming to osteopath, to you as an osteopath, like, how many sessions might it take for them to feel relief? Is it like a one and done thing? Is it like, for months, or how long would they have to come?
So, my general rule of thumb to feel the true benefits of osteopathy is 5 treatments. And I do explain in the initial treatment, depending how their body feels and how it responds to that first treatment, will usually tell me whether that number can be lower or higher. So,
Mm-hmm.
when something has been very chronic, um, and there's been potentially some trauma that's led to that chronicity, or they live a very high paced life and they don't have time to slow down, I find the treatment process will take a lot longer.
Mm-hmm.
But if they can do osteopathy, often I'll recommend pelvic physio at the same time.
Mm-hmm.
And that way, as the pelvis gets internally released, then we can balance out the rest of the body to deal with that release and then kind of continue on that way. And we've seen really good results in the clinic by combining those two modalities. And then, of course, then doing the at home work, which Alice and I were talking about before we jumped on live here, but how
Mm-hmm.
important the at home breath work is, and exercises, and really trying to take that ownership and education to maintain that pelvic health and keep pushing to get better.
Mm-hmm. I want to circle back. You talked about um somebody that you talk. like one of the factors is like how stressed a person is,
Yeah.
right? So do you notice that it's harder for bodies to heal that if you're always hanging out in the sympathetic nervous system, you're always stressed, you have this like it's like chronic and you're not doing anything to actually stop the stress response, right? Do you notice that that takes longer than if you're not taking that time to um, make relaxation a priority each and every day?
100%. And oftentimes, I would say those people are the people that they can't sit,
Mm-hmm.
right? They can't sit. They're like, they either feel like there's too much to do or they're just like, oh, I get bored quickly. So I like doing stuff. There's a bit of a disconnect to stillness.
Mm-hmm.
So that's honestly one of the hardest parts. I find treatment itself and finding out what's wrong with the body pretty easy. It's the whole psyche of relaxation and trying to teach how important it is to, yes, it's fine to go, but you have to match that with the opposite.
Yeah, the yin and the yang, right? Like if
Yes.
you have
Yeah.
one, you need to have the other. And that is, I think I'm a very antsy person in general, so I can relate before I understood, I guess, the importance of the parasympathetic nervous system, right? Since then, like I've gone on, to learn so much I'm fascinated about the stress response and how it impacts the body. So I've gone on to learn a lot about that. And that's what I wanted to ask you in your practice if you notice the same thing, that when you're highly stressed, it's so hard for the body to repair because it's not focused on that anymore, right?
Yeah, definitely.
So where if somebody wants to work with you, they want to work on some at home like tips and stuff like that. I know that you can't do manual stuff, but if they want to work on some at home tools with you, where can they reach you to book a virtual appointment? Or if they're in the Scarborough area, where can they reach you at your clinic?
Yeah, of course. So all of my information's on my website, smtosteopath.com.
Mm-hmm.
So SMT actually is Sarah's Manual Therapy. That was my business name when I was in school. So we called it initially Sarah's Science and then graduated to manual therapy. And then now I've added a classical osteopathy to the name. So smtosteopath.com. And you can find me on Facebook and Instagram at SMT Osteopath as well.
Awesome. Thank you very much for your time. I'm actually going to put all of Sarah's information in the comments if you're watching in the group. And if you're going to watch on YouTube later, then it'll be in the description box as well. So I want to thank you again so much, Sarah, for coming to share your knowledge with my wonderful group. The group is growing, and my goal is to find as many people remission as possible so they can get some relief from their bladder and pelvic pain, because as you know, anything that's chronic with the body is a quality of life issue. So if we can help people, and you're helping people every day, Sarah, eliminate that. So it's such rewarding work when you can help somebody have a better day, have a 2 out of 10 pain day or 0 out of 10 pain day. It's so rewarding.
Yeah, very rewarding. I agree, Alison. So thank you for all your work you do.
And thank you for what you do as well. And I look forward to having you back at another time to talk on a different topic. And thank you so much for all the things that you do. And I will see you next time.
Okay, sounds great. Thanks,
All right,
Alison.
no problem.
Bye.
Bye. We have reached the end of this video. Please know that you are not alone, and there are so many treatment options for pelvic and bladder pain. Keep the hope alive. And remember, if you found this video helpful, please click the like button and be sure to subscribe and follow for more videos like this. Thank you for watching.